My name is Gabriel Peñafiel, and I will talk about acute methotrexate-induced crystal nephropathy. Definition: Nephropathy. Nephropathy is considered a progressive illness which denotes disease or damage of the kidney, which can eventually result in kidney failure. The primary and the most obvious functions of the kidney are to excrete and waste products to regulate the water and acid-base balance of the body. Therefore, loss of the kidney function is a potentially fatal condition. Methotrexate. It treats cancer by slowing the growth of cancer cells, also treats the psoriasis by slowing the growth of skin cells to stop scale from forming, and may treat rheumatoid arthritis by decreasing the activity of the immune system.
Hi, I'm Andrew Jordan, one of the rheumatologists. At BJC Health. In today's video, I want to address one of the biggest myths about methotrexate, in that it is a chemotherapy drug. Methotrexate is actually used for rheumatoid arthritis and psoriatic arthritis, and it is used for chemotherapy. The main difference is the dose. In rheumatology, we use it as a tablet that you take once a week at a dose of about 20 milligrams on average. In chemotherapy, it is used as an infusion into the vein and usually given in very high doses, up to 3,000 milligrams or more. The dose difference is about 100 times. So as you can see, I liken it to whether you have one drink of beer or 100 beers. The side effect profile is going to be very different. A lot of the things you may read up online may be actually incorrect, as it's referring to this huge dose that's used for chemotherapy. At the doses we use, the actual side effect profile is nothing compared to the chemotherapy dose, and it is completely inappropriate to consider it a chemotherapy drug when it's used at the doses we're using in rheumatology. I hope this answers the myth about methotrexate and chemotherapy.
Applications in medicine. Acute kidney failures occur when your kidneys suddenly become unable to filter waste products from your blood. When your kidneys lose the filtering ability, to dangerous levels of waste may accumulate and your blood's chemical makeup may get out of balance. Acute renal failure occurs in approximately 2% of patients who receive high doses of methotrexate from the treatment of hematologic cancer.
Hey, this is Medicos Perfectionalis. Let's talk about urine crystals. So urine crystals are urine sediments that have specific shapes under microscopy. So if you know the shape, you can know what type of stone it is, and it will be of great help on your board exam because it will describe to you like the stone. Like for example, hexagonal shaped stone, it's like cysteine. Rhomboid, it's uric acid, etc. So that's the topic of today's video. So these are the most high yield crystals for your exam and for life. So first we have the envelope shaped crystals. These are the calcium oxalate. The mnemonic, or the way that I remember it, that calcium oxalate stones are the most common type of stones. So the envelope is the most common shape that you see in your life. You receive and send mail all the time. So calcium oxalate, envelope. Let's go to cysteine stones. They are hexagonal in shape. How do I remember it? Cis looks like 6. Okay, especially if you know French or Spanish, it's pretty close. We have the struvite stone. Struvite stones are bad, like really bad. The shape is coffin, which is bad. Okay, the way I remember it, you can say struvite as starve to death, and death is related to the coffin, of course. Last, we have uric acid. They are rhomboid in shape. The way I remember it, uric acid, sometimes like gout comes into mind. And in gout, like the definitive diagnosis is to get joint aspirate, okay, to see these crystals, okay, and if you see them, they are negative birefringent and they are elongated. So here, this is the most elongated shape, okay, in this stuff. So uric acid rhomboid. So envelope calcium oxalate, hexagonal cysteine, coffin-shaped struvite stones, the evil one, rhomboid-shaped uric acid.
Methotrexate may reduce the burden of heart disease in rheumatoid arthritis. Low-dose methotrexate is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community. It helps many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling, and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are two ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems, whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate.
Pros and cons. Pros. It treats cancer by slowing the growth of cancer cells. Also, it treats the psoriasis by slowing the growth of skin cells to stop scale from forming. And also may treat rheumatoid arthritis by decreasing the activity of the immune system. Cons. Methotrexate may cause a decrease in the number of blood cells made by your bone marrow. Also may cause liver damage, especially when it is taken for a long period of time, and may cause lung damage. Finally, may cause crystal-induced nephropathy.
Hi, I'm Andrew Jordan, one of the rheumatologists at BJC Health. Following on from one of our previous videos on methotrexate, I'd like to talk a little bit about the side effects. It may be surprising to know that 70 to 80% of people don't get problems with methotrexate. I'd like to talk a bit about the 20 or 30% of people who may get problems. Typically, the problems will occur 1 to 2 days after taking it, and it is a weekly medication. The most common ones here would be headache, a foggy feeling in the head, or nausea. This may require dose adjustment, or occasionally, if it is very bad, we would have to use a different medication. Other side effects may include mouth ulcers or hair loss, but usually we can manage this with dose adjustment or using some other medications to counteract that. You will require some monitoring of blood tests with methotrexate. Typically, this would include the liver test and full blood count. If there are abnormalities here, usually we don't need to discontinue treatment, we just need to adjust the dose. There are, of course, a long list of other potential problems with methotrexate that you may read about, but they are really quite rare and unlikely to occur. So,
issues apply in Ecuador. Chronic kidney disease is the fourth and fifth premature mortality cause in Ecuador. Mortality levels are between 6 and 7%. Methotrexate is widely available and used in Ecuador.
Methotrexate is commonly used to treat rheumatoid arthritis and many other autoimmune and inflammatory conditions. In fact, it's the first line of treatment for most people after they're diagnosed, and it serves as the gold standard against which other treatments are evaluated. Methotrexate can be used by itself, but also it's frequently combined with other medications to control your disease. Methotrexate works by turning down parts of the immune system that are revved up in RA and other conditions. It helps get your body's inflammation back under control. When people first hear about methotrexate, they're often concerned because this medication is also used to treat some forms of cancer. But it's very important to remember the doses that rheumatologists use are hundreds of times smaller than the doses used for cancer. Therefore, many of the side effects seen with chemotherapy are not seen with the lower doses. Methotrexate has been used to treat autoimmune conditions since the 1980s. Its safety record and the doses that rheumatologists use, which are about 15 to 25 milligrams a week, guidelines for monitoring these side effects are all well established. In most people, methotrexate does not cause any problems. We also give a prescription of a vitamin called folic acid to take every day while you are on methotrexate. This helps to cut down many of the possible side effects. Sometimes another vitamin, folinic acid or leucovorin, is also used. Methotrexate is taken once a week, not every day. It can be given as pills or in an injection. So you will choose a day of the week that works best for you, for example, Sunday. You'll then take your methotrexate every Sunday. Before taking this medication, your rheumatologist will check to make sure you're able to take methotrexate. You may not be prescribed methotrexate if you have cirrhosis of the liver or other liver diseases, if you have certain lung conditions, if you're a woman who is pregnant or trying to get pregnant, if you're a man who is trying to get someone pregnant, you have blood cell disorders such as anemia, which is a lack of red blood cells, or leukopenia, which is a lack of white blood cells, if you're breastfeeding a baby. Methotrexate can cause birth defects in the unborn baby. You should be on a sure method of birth control while taking methotrexate, whether you're a man or a woman. Tell your doctor right away if you become pregnant during your treatment. You may need to have a negative pregnancy test before starting treatment. Once you stop taking methotrexate, you should continue using birth control for at least 90 days before attempting pregnancy. Methotrexate is broken down by the liver. We generally recommend that people drink no more than 1 to 2 alcoholic beverages per week to minimize the chance of liver injury.
Conclusion. Methotrexate may cause very serious life-threatening side effects. You should only take methotrexate to treat cancer or certain other conditions that are very severe and that cannot be treated with other medications.